What stood out for me was a comment that Richard Horton made about how people who read the book can take confidence from some of the findings that we take with regard to change, and how it's possible for a country to improve its health. I think that's an important thing for people to take from our study. Something that struck me from the Social Determinants of Health, Michael Marmot's report, was that health is not poor health is not a natural state, and it's he describes it as a toxic combination of unequal economic policy, weak social policy, and frankly bad politics. And so the converse of that is that good politics, equal economic policy, and strong social policy can make a big difference. So I think Richard Horton is right. People can get something positive from our study and be confident that they can change if they want to. Although the contexts are very different and the country experiences are very different, issues like trust, that's a theme that political scientists get very excited about. If you have a citizenry that trusts you and believes that you're going to do something in their interest, then you'll find that making reform is much easier. So in Thailand we see trust in the royal family. Kyrgyzstan, World Bank found that in terms of trust, it has much higher trust than some of its neighbours like Tajikistan and Kazakhstan, and that makes it easier to push for reform. Trying to introduce gendered politics, that's very important for improving the social determinants of health. Trying to address inequalities, these are very important issues. So I think countries can recognise that their contexts are going to be different, but they can see that there are common issues.